Welcome back guys. Now in this video let's discuss about viral hepatitis. So what exactly is viral hepatitis? In the name itself it's there, hepatitis, inflammation of the liver because of virus. Okay, because of certain viruses there is viral hepatitis. So how many types of viruses are there? Okay, hepatitis A, B, C, D and E. So there are these 5 viruses which can lead to viral hepatitis. Now out of these 5 viruses, let me tell you the important points here itself. So virus B and C, or let me say something like this, first begin, except hepatitis B virus, okay, except hepatitis B. All other are RNA viruses, okay, except hepatitis B, all other are RNA viruses. Hepatitis is a DNA virus. All other RNA viruses. Okay. Next, hepatitis B and C, they will lead to chronicity. Okay, usually hepatitis B and C, they shows chronicity, which means they can be there for a long period of time, they can be chronic in nature and they can even increases the risk of cirrhosis. They can even increase the risk of cancer. So there is a chance of chronic inflammation, the chronicity you already know it, and there is a risk of cancer, hepatocellular carcinoma. Okay, and there is a risk of cirrhosis. So with B and C, not with the others, not with the A, D and E. Okay. Next, so what are the symptoms which can be seen in a patient who is having this viral hepatitis? Symptoms. The patient is going to have right upper quadrant pain. Okay. So right upper quadrant pain is going to be seen. Since the hepatocytes are dying, okay, as the hepatocytes are dying, there can be jaundice. Okay, the jaundice can be seen, the yellowing of the skin, icterus, the bile salts are going to accumulate in the skin. Okay, the bile salts, now they will start to accumulate in the skin and that will cause itching. Okay, the patient is going to have itching due to accumulation of bile salts. Okay, this is the one thing. Next, what else can be seen? So these patients are going to have dark colored urine. Okay, the urine is going to be dark yellow colored. So the stools are going to be clay colored. Okay. So clay colored stools. Why the stools are clay colored, I will explain you later. So these are the usual symptoms that are seen with the hepatitis. It doesn't matter whether it is A, B, C, D or E. Usually a patient who is having this viral hepatitis is going to have right upper quadrant pain, jaundice, itching, dark colored urine and clay colored stools. These are going to be seen, sir. See, normally let me tell you something. It's the RBC degradation. Okay, RBC destruction. When the RBCs are getting destroyed in the reticular endothelial system, that's the spleen, who is going to be released? So the bile pigments are going to be released. So the RBCs are getting destroyed. From the RBCs, the hemoglobin is going to be released. Even the hemoglobin is getting metabolized. So heme is going to split into iron and protoporphyrin. The metabolism of or the breakdown of protoporphyrin is going to release bile pigments. Normally, let me tell you what is something normal. Okay, so RBC destruction will produce bile pigments. So what is that bile pigment? Bilirubin. Okay, it's a bilirubin. So now the bilirubin is unconjugated. Normally the bilirubin is unconjugated. What happens in the viral hepatitis is normally liver helps in excretion of this bilirubin. The liver helps in excretion of this bilirubin. Now in our viral hepatitis, the liver is not functioning. So do you think excretion will happen? The excretion is not going to happen. If excretion is not happening, what happened to the bilirubin levels? The bilirubin levels are going to be elevated. So the patient is going to have liver damage. So no excretion of bilirubin out of the body. So this bilirubin will start to accumulate in the body, and that's what is causing the yellow color of the skin. Okay, the jaundice. Okay, so these are some important points which I want you to know, sir. Apart from this, now let me tell you, which is something usual, normal, liver. Why that clay colored stool and why that dark colored urine? Same, liver is going to release the conjugated bilirubin, you know it. Okay, already I have discussed what is something normal. So, liver is going to release the conjugated bilirubin normally. Okay, conjugated bilirubin. So, unconjugated bilirubin will come to the liver. In the liver, the unconjugated bilirubin is converted into conjugated bilirubin with the help of that enzyme uridine glucuronyl transferase. Already we have discussed in the basics video. Okay, we have discussed what is a normal, like physiology. Now, liver produced this conjugated bilirubin. Now, this conjugated bilirubin, now it came into the GIT. Okay, the conjugated bilirubin, now it came into the bile. From the bile, it came into the GIT cell. Now, this conjugated bilirubin is acted upon by bacteria. Okay, it is going to be acted upon by bacteria. Now, when bacteria acting on this conjugated bilirubin, the conjugated bilirubin is converted into urobilinogen. Okay, it is going to be converted into urobilinogen. So, this urobilinogen is going to convert into stercobilin. Okay, now this stercobilin is coming out in the feces. Now, this stercobilin is the one which causes, okay, the brown color, okay, dark brown color. Okay, dark brown color. Okay, it's the one which causes the dark brown color to the feces. Okay, it gives color to the feces. So, normally liver is releasing the conjugated bilirubin. Conjugated bilirubin is acted upon the bacteria. Bacteria is going to convert the conjugated bilirubin into urobilinogen. The urobilinogen will be later on converted into the stercobilin. Okay, the stercobilin is the one which gives the color. See, the urobilinogen, okay, the urobilinogen, some amount of urobilinogen is reabsorbed back into the blood. Okay, is reabsorbed back into the blood from the GIT. See, from the GIT, the urobilinogen is reabsorbed back into the blood, some amount, and from this blood, it is going to get filtered in the nephrons. It is going to get filtered in the nephrons, and it is going to come out in the urine. So, some amount of urobilinogen is getting reabsorbed from the GIT. From the GIT, where it will go? It will go into the blood. From the blood, it is getting filtered in the nephrons, and this urobilinogen which is the one which causes the color to the urine. Okay, it is the one which gives the color to the urine. So, because of this urobilinogen, there is color to the urine. Okay. Now, what happens in viral hepatitis? In viral hepatitis, what happens is the conjugated bilirubin. Okay, the conjugated bilirubin. See, liver is still having the capability. To produce this conjugated bilirubin. Yes, conjugated bilirubin is produced, but the conjugated bilirubin is not excreted into the bile. It is not kept into the bile. Okay, it is not kept into the bile. So, this conjugated bilirubin, it leaks into the blood. Okay, it is not going into the bile, rather it goes into the blood, and from the blood, this conjugated bilirubin, it will go into the urine. So, because of this conjugated bilirubin which is there in the urine, the urine will get the dark color. And that is okay. See, this conjugated bilirubin, it is not going into the GIT. As it is not going into the GIT, now there is no color for the feces. So, that is why the color of the feces is going to be clay colored. Why the clay colored feces? Because the conjugated bilirubin is not coming into the bile, it is not coming to the bile, it is not coming to the GIT. Okay, because of hepatitis. In hepatitis still, liver is having a capability to convert unconjugated into conjugated, but it is not properly being excreted into the bile and into the GIT. As the conjugated bilirubin is not coming into the GIT, It's not getting converted into urobilinogen, stercobilinogen. It's not coming out in the feces. So as it's not coming out in the feces, the stools are going to be clay colored stools. The conjugated bilirubin, it will rise, the levels of conjugated bilirubin levels rises in the blood, and this conjugated bilirubin, it will filter in the kidneys, it will come out in the urine. So that's why the urine is dark colored, the stools are clay colored. Okay, these are the points which I want you to know. Now in a patient who is having this viral hepatitis, if you look at the labs, what you will see in the labs, the ALT levels are elevated as well as AST levels are elevated. Okay, again I am reminding you, the AST levels are elevated in alcoholic hepatitis. In alcoholic hepatitis, the AST levels that are elevated. Okay, now what about the bilirubin levels? So the bilirubin levels are elevated in the blood. Okay, so conjugated bilirubin as well as unconjugated bilirubin also. So liver is getting damaged. So both the conjugated as well as unconjugated bilirubin levels both will rise. Okay, because say some hepatocytes are dying, sir. Some hepatocytes are dying. As the hepatocytes are dying, now the liver capacity to convert the unconjugated bilirubin to conjugated bilirubin decreases, little bit decreases. So unconjugated bilirubin levels rises. As the liver cells are dying, there is a possibility that these cells will leak, okay, the conjugated bilirubin into the blood. So both conjugated as well as unconjugated bilirubin levels both will rise in viral hepatitis usually. Okay, so they are raised. Okay, bilirubin levels are raised, but mainly conjugated bilirubin levels. Okay, direct conjugated or direct bilirubin levels are raised. Next, so usually these patients who are having the viral hepatitis, they shows false positive VDRL test. If you do VDRL test in them, it shows unnecessarily positive, false positive. Okay, false positive cases can be seen. Next, after this, let's begin with the hepatitis A virus. Okay, after telling you the basic things, hepatitis A. Sir, hepatitis A virus, it belongs to which family? It belongs to Picornaviridae. It's a picornavirus. So who else or which other viruses are belonging to this Picornaviridae? So other viruses includes poliovirus. Okay, ecovirus, rheovirus, or I should say rhinovirus, not rheo, rhinovirus, Coxsackie virus, Coxsackie A, okay, Coxsackie A virus, and last hepatitis A virus. So all these viruses are belonging to Picornaviridae: poliovirus, ecovirus, rhinovirus, Coxsackie A virus, and hepatitis A virus. So how one can get this hepatitis A virus? How it can enter into our body? Hepatitis A, how it can enter? So hepatitis A virus comes into your body via the fecal-oral route. Okay, it comes into your body via the fecal-oral route, which means via the contaminated water. Okay, usually most of the time it's going to come into your body via the contaminated water. So what kind of virus is this hepatitis A virus? So this hepatitis A virus, it is single-stranded RNA virus, single-stranded, non-enveloped. So it is single-stranded, non-enveloped, linear RNA. Okay, so linear virus. Okay, now what is the incubation period? See, incubation period, once it enters into your body, the incubation period is going to be 30 days. Now my question to you is, how you will get this virus? So via the fecal-oral route. Usually most of the times in your exam they will mention that the patient have travelled to a new place. Okay, a westerner have travelled to a new place, a developing country or underdeveloped country. Now the patient can get this hepatitis A virus, and the most important point is this hepatitis A virus will not cause chronicity. It will not cause hepatocellular carcinoma. Okay, it's going to be usually a self-limiting condition. Self-limiting condition. It's a self-limiting condition. There is no chronic stage. Okay, there is no chronic states. Seen in, I forgot this one point, seen in travelers to underdeveloped countries. It's a self-limiting condition, sir. Next, what else I want you to know is, sir, how can we know that the patient is having a disease? Acute disease. How can we know that the patient is having right now acute hepatitis B? Okay, there is no such thing as chronic. How can we know that right now there is acute disease? Now, the patient is going to produce IgM type of antibodies, and acute phase definitely M type of antibodies are going to be seen. So, IgM antibodies, okay, IgM anti hepatitis A antibodies, okay, IgM, okay, anti hepatitis A IgM antibodies are going to be seen, okay. If you are having prior infection long back, okay, long back, if you are having prior infection, if you are having a prior infection, these IgM antibodies are going to be converted into IgG type of antibodies. So, if you see IgG, okay, hepatitis A antibodies, okay, IgG anti-hepatitis A antibodies, it doesn't mean it's a chronic infection, it doesn't mean he is having a chronic infection. Now, there is no such thing as chronic infection. If you have IgG antibodies, it means previously he had an infection, the prior infection, it indicates prior infection. What else you should know is, sir, on histology. So, this hepatitis A microscopic examination of hepatitis A. So, the infected liver cells, okay, not only just in hepatitis A, but it can also be seen in other hepatitis. So, the infected liver cells, now they are totally swollen, the hepatocytes are going to be swollen. This is called as ballooning degeneration. Okay, ballooning degeneration. Okay, so what is this ballooning degeneration? It's the swelling of the hepatocytes. The hepatocytes are getting swollen and they are undergoing necrosis. So, swelling of hepatocytes. Okay, now these hepatocytes are undergoing necrosis. So, this dying hepatocytes. Okay, these are the dying hepatocytes. They are undergoing necrosis. Next, what else I want you to know is, this is what is seen on the histology, sir. Okay, this is what is seen on the histology. The ballooning degeneration or the swelling of the hepatocytes is seen, that indicates the necrosis. Apart from that, not only necrosis, when the liver cells are infected with this virus, so within the liver cells now the virus is there. So, the cytotoxic T cells will recognize, okay, this is the liver cell which is infected with the virus. Now, cytotoxic T cells trigger, what they trigger? They trigger apoptosis. Okay. Now, they trigger the apoptosis. Now, the cytotoxic T cells will come and they will start to trigger the apoptosis of the infected hepatocytes. Now, this apoptosing hepatocytes, the dying hepatocytes are called as Councilman bodies. So, what exactly are the Councilman bodies? The Councilman bodies are the hepatocytes that are undergoing apoptosis. Okay, Councilman bodies can be seen. So, it's done by cytotoxic T cells. Who is mediating this? Cytotoxic T cells. So, from this I can say one thing, sir, in viral hepatitis there is necrosis seen, that is a ballooning degeneration, also apoptosis. So, both necrosis as well as apoptosis both can be seen, sir. Now, apart from this, what you can see is, so there is mononuclear inflammation, means the mononuclear cells, the lymphocytes are going to come into the liver, into the liver lobule. So, there can be mononuclear inflammation. Okay, mononuclear inflammation, that is the lymphocytes are going to be coming into the liver, lymphocytes. Next, there can be bridging necrosis. These are all seen in the histology, bridging necrosis. So, what is this bridging necrosis if you ask me? So, the swaths of dead hepatocytes, okay, swaths, the pathway, okay, the paths of dead hepatocytes span across the lobules, okay, across the liver lobule, okay, the liver is divided into lobule sites. So, swaths of dead hepatocytes span across the lobules. Okay, this is what is called as a bridging necrosis. So, what can be seen on the histology? There is ballooning degeneration that can be seen. There can be apoptosis, which is called as the councilman bodies. The dying hepatocytes are called as the councilman bodies. There can be mononuclear inflammation with the lymphocytes, and there can be bridging necrosis. And the patients, the keyword that they will use in your exam is periportal mononuclear infiltrate. That can be seen. Periportal mononuclear infiltrates can be seen. When you see the word periportal mononuclear infiltrates, think about hepatitis A. Okay, think about hepatitis A. So, these are what are seen in the histology. So, what are the important points that I want you to know regarding the hepatitis A virus? See, hepatitis A virus is belonging to the picornaviridae. It is a single stranded RNA virus, which is a non-enveloped virus. It is a non-enveloped ssRNA virus, which is linear ssRNA, linear shaped. Okay. Next, hepatitis A, how you are going to get it? Usually travelers get it via the fecal-oral route. When a traveler is going to underdeveloped country, there he can get this virus. There is no chronic phase. It's a self-limiting condition. Usually hepatocytes will die. It's a self-limiting condition, sir. Okay, the liver will regenerate. Nothing a big problem. When the liver is dying, you know the basic things will be there, like right upper quadrant pain, jaundice, nausea, vomiting. Okay, the icterus, itching. All these things can be seen, but it's a self-limiting condition. Okay, so what indicates acute phase? So acute phase, acute infection right now. To know whether the patient is having acute hepatitis A or not, you have to check for the IgM antibodies, IgM anti-hepatitis A antibodies. If you see IgG anti-hepatitis A antibodies, that indicates a prior infection but not the chronic infection. There is no such thing as chronicity. There is no risk of hepatocellular carcinoma. There is no risk of cirrhosis usually. Okay. Now, after this, let's discuss about hepatitis E virus. Okay, hepatitis E virus. Same. So, what about this hepatitis E virus? Sir, hepatitis E virus, it is also ssRNA virus. It is also single stranded RNA virus. This is also non-enveloped. It is also non-enveloped. So, non-enveloped single stranded RNA viruses, hepatitis E. Okay. So, how you will get this hepatitis E virus? So, just like hepatitis A virus, just like hepatitis A virus. That is why after hepatitis A, I am discussing about hepatitis E virus. How you will get it? So, you are going to get it, okay, traveling to underdeveloped countries. That is the fecal-oral route, same fecal-oral route. Okay, fecal-oral route, contaminated water. Okay, taking the contaminated water, going through underdeveloped countries. The one important point regarding the hepatitis A is, say, it does not cause any chronicity. It is a self-limiting condition, not a big problem, not a big problem. But when you get this hepatitis E virus during pregnancy, okay, first let me write one by one points. So, there is no chronicity, okay, there is no chronicity, it is a self-limiting condition. Okay, it is a self-limiting condition, but when you get it during pregnancy, do you know, there will be acute fulminant hepatitis. Okay, fulminant hepatitis can be seen, acute fulminant hepatitis. So, what exactly is this acute fulminant hepatitis? Acute fulminant hepatitis means within a very short period of time, within days, there will be liver failure. Okay. So, if it occurs during pregnancy, if hepatitis E occurs during pregnancy, there can be acute fulminant hepatitis in the mother. Almost the mortality rate, okay, in the mother is going to be somewhere between 15 to 25%. So, 15 to 25% there is a chance that she can die, sir. Okay. So, in pregnancy it is dangerous, otherwise it is self-limiting, not a problem. So, we have completed hepatitis A and hepatitis E. In the next video, we will be discussing about hepatitis B, C and D. Okay guys, see you in the next video. Hope the video is helpful. Thank you.